They probably need to unmute themselves. Okay, well, just for the logistics, if we're not speaking, we understand that we'll mute us. We mute ourselves when we have to unmute ourselves if we have to speak, just so we don't get any background noises as each and every one of us start presenting ourselves. That's just some background. Capital TV, are you ready?
Chairman Hull, can you hear us?
Now I do.
All right, awesome. You're good to go.
All right, 5, 4, 3, 2, 1. And we're live. Good afternoon, Rhode Island. Good afternoon, distinguished members of this task force. I welcome you all once again to the COVID-19 task force set up by Speaker Sakachi. As we begin, I know there are plenty of people outside our audience that are watching this, and they are here on purpose. We ask them to tune in. So with that in mind, I have to read a couple of things first before we begin, because a lot of people are tuning in because of what we're going through. So for people who are just tuning in, who want to know what's going on and how we were established, I will read this. The purpose of the task force is to ensure that Rhode Island distribution of the vaccine is done in a timely manner following CDC guidelines, and that frontline workers, health compromised, and the elderly are given access first. And also to make certain that the needs of the underserved population are appropriately addressed. The task force will work closely with Rhode Island Department of Health and to learn about the state vaccine program. The people that are on the task force are Karen Volati, District 60 of Pawtucket, Representative Chippendale, District 40, Forster, Gloucester, Coventry, Representative Fogerty, District 35 of South Kingstown, Representative Gioraldo from District 56 of Central Falls, Carol McAtee from District 33, South Kingstown, Narragansett, Representative McGraw from District 71, Portsmouth, Tiverton, and Little Compton, Representative Messier, District 62 of Pawtucket, Representative Martino Ray from District 25, West Warwick in Coventry, and Representative Place, District 47, Verville in Gloucester. With that said, that is the groundwork on how we were established and how we were getting started with the direction of Speaker Sakachi. With that said, I'm going to get away from a little bit of what we were designed to do today, because now it's designed for us, for you to listen to what we have been hearing from our constituents. With that in mind, Dr. Ja, I will only allow you to go first because you have something else to do, but I will tell you, and the people who are watching, it will be totally different this time because we have a responsibility to the people we serve. So Dr. Ja, with that in mind, understand where we're at and the complications that are going on and what we're offering you to constituents. We respect your position, much like Dr. Scott, Dr. Chan. It's not a gotcha moment, but it is a moment that we need to be with our people, our constituents, and I mean that on purpose, because there's a lot of heart and soul that we all heard from the people in our districts. So with that said, Dr. Ja, and please understand where we're going to go with this meeting, this session. Dr. Ja, would you please proceed? Could you unmute yourself, please?
You would think after all this time I would know how to unmute myself. I apologize. What I did say was, Chairman Hall, members of the legislature, thank you very much for having me, and I apologize for starting off there muted. I'm going to keep my remarks really short because I want to have more of a discussion. And what I'm going to try to do is lay out What I am learning, as many of you know, I spend a lot of my time talking to both federal policymakers as well as state leaders from around the country. I've been tracking vaccines and vaccine rollouts very closely across the nation. And what I want to lay out is what I think are the key lessons, and then think about how they apply here in Rhode Island. I think we're doing many of those things. There are clearly areas where we could do better. We can always do better. And then I think you'll hear from Dr. Alexander Scott and Dr. Chan much more about some of the things that are happening here in Rhode Island. So I'm going to talk a little bit about what are the lessons I'm going to so far nationally and think about how they may apply here. So when I think about the states that are really at the top of the heap in terms of getting vaccines out and into people's arms, there are about 5 or 7 things that are here pretty consistently across states. And let me go through them and to keep that list in mind as we focus. So one is simplicity. What you see over and over again in states that have high levels of vaccinations is that their rules are relatively simple, that the more complexity there is in the process of who's eligible, who's not, where is it, it tends to slow things down. So simplicity is something that we should always value. It is not the only thing we should value, but it is a high value item if the goal is to try to get vaccines out to people as quickly as possible. Second is what in lots of states you see a singular focus on making sure there are no vaccines sitting on shelves. So when you look at states like West Virginia, North Dakota, New Mexico, even Connecticut, the proportion of vaccines that they have gotten that have not gotten administered is tiny. And that is across all the different distribution channels, from the long-term care facilities to what's gone to hospitals to what's gone directly to states. And it is built on the idea that you are counting on the supply chain to deliver the second dose. So remember, everybody needs a second dose, and a lot of states have held back a second dose, some doses thinking we need it for the second dose. The states that are the furthest along generally tend to say, we are confident the second dose will show up through the future shipments. Let's get everything out into our arms first. The third is really about using the full power of government. And here, what I have heard over and over again is that most of these vaccination efforts of states that are really far along in terms of vaccinating people is that they have someone running it out of the governor's office who is using all the powers of the government to move things forward. So for instance, I was talking to a state leader, not a health leader, but a political leader of a state that's done quite well. And they were talking about how nursing homes are often very slow to respond when CVS calls them and says, we're ready to come and vaccinate. It may take them a week to get a response back from the nursing home. What these folks do is they sit down with CVS and say, which nursing homes are not responding? Then they pick up the phone and call the regulator of the state, in the state who regulates the nursing homes. And that regulator calls the nursing home and says, do you want your license to be renewed? You need to respond to this and deal with it. So that's where you start using the different levers of government to try to push things that are causing stuff to slow down. So I think of that as government as problem solver, often coming out of the governor's office. One of the things that, again, states that have been, I think, really successful, and here Rhode Island has been doing a really good job on this, I would argue, but is focusing on key populations that have been hit the hardest. And here I think about what we've been doing in Central Falls with Mayor Rivera and the effort to try to get Central Falls vaccinated, one of the hardest hit communities in our state. Again, that's a pretty consistent theme among high-performing states. Focus on those key populations where things are going not so well. And then let me just make 2 more quick points, and then I will stop. One is, what's interesting is, one of the questions I am often asked is, what's the right strategy? Should we be using pharmacies? Should we be using our healthcare system? Should we be going out to community health centers and clinics? What's interesting to me is every state does that a little bit differently. There are states that are relying primarily on their large health systems. Connecticut, for instance, is one of them. 2 large health systems, and much of their vaccinations has happened through those large health systems. Other states have used primarily their retail pharmacies like CVS and Walmart and Walgreens. My answer on that is, it depends on your state, where you have the relationships and where you feel like you have the greatest level of reliability. and that there is no single formula that works across all the states. But states have to identify where can they make sure that their distribution channel works. Last couple of key points, and then I will wrap up. One of the things that, again, has been really frustrating for a lot of people in a lot of states is the issue around how easy it is for patients or people who want to get vaccinated to navigate the system. Some of the best performing states have a single, simple registration system. It's a centralized system. It allows people to go to one place, get registered, and then those places are active in following up with people using text messaging, using other technologies to reach out when it's somebody's turn and get them into places and send them off to places where they can go get vaccinated. Simplicity, again, not just in the rules of who's eligible, but simplicity in how patients or people navigate the system. And last point I want to just mention is one of the things that I'm seeing from states that I think is really important is this idea of engaging everybody. So if you're a 35-year-old healthy person, you're not getting vaccinated today. You're not getting vaccinated tomorrow, probably a couple of months away. And some of the states, what they're doing is if someone who's 35 and healthy, they can go get registered today. And they'll be told, well, you're probably not getting vaccinated anytime super soon. But they're texting those people on an ongoing basis and saying, hey, you're about a month and a half away. Hey, you're about a month away. And what you're doing is you're keeping people engaged. Because if you tell people, come back in 3 months, you know what that means. Most of those people are going to forget, they're not, and then we're going to be chasing after them. So that's not a short-term fix issue, that's a long-term engagement issue. So that, in all of our work across the country, looking at different states, those are some of the key lessons that I think we have been able to boil down that really identifies what states that are furthest along are doing. I think many of those are happening here in Rhode Island. And again, we've got people here on this call who are far more expert than I am about how things are, what exactly is happening here. But I think we can always learn lessons from others, since I just wanted to highlight some of those as key things that we can focus on. So let me stop and take questions or comments from all of you. But I wanted to start with, here's what I think are some things that we could all do better.
Thank you, Doctor. I listened to some key points that you brought up, which signal leadership and direction. I like that, and I'm glad you brought it up. And this is where we're at now as a task force, why the task force was formed. I will open up for questions strictly just for you, but I want you to hear and everyone else to hear from the public, which we serve, and they have questions. And I know you have to go, but we've been talked to quite a bit. And you said a lot here right now. And leadership is the key. So I will open up for questions. And Dr. Scott, no disrespect to you, or Dr. Chan, no disrespect to you also. But this is important right at this point because we've been hammered, and rightfully so, because these are the positions that we chose to take. So with that first question, just raise your hand, and I will call you Representative McGraw.
Thank you, Chairman Hall, and thank you, Dr. Jha, for that. And I want to start off asking you about your number one point, because that's actually my number one question, talking about simplicity. And what I am hearing from people consistently is how confusing and complex this process is, especially as we start with an older population that may not be as internet savvy as, our 20-somethings. So we have multiple paths for people to get vaccinated, and I understand that, but it's really complex for people to navigate through. They're told you can check the CVS website, you can check the Walgreens website, check in with your town, check in with the state possible, that there's a vaccination program through the state now. Each town is doing it differently. So they're talking to their friends and neighbors and saying, well, in this town, they're registering this way. In this town, they're notifying people this way. And there's no consistency whatsoever. It's incredibly confusing for the population of people who are trying to sign up to get a vaccine. I have been asking for some time now if there's a possibility that we could do a statewide registry that would help to steer people in those directions so that they don't have to try to maneuver a system or go on at 7 o'clock in the morning for a drugstore, a pharmacy vaccination, when they go on at 7 o'clock and it's 7:01, they're all booked. And they're going from here to there and asking family members to help them. And it is just really, really complicated for people who are trying to navigate the system. So what I want to know is, how do we, as a state, provide a more simplistic option for people to sign up, to register for when they are going to be available to get the vaccine, like you said. And it doesn't, we can prioritize people that are older, but anyone should be able to sign up to get those regular updates. How can we make that happen here in Rhode Island so that it becomes a simplified process for people to understand, to navigate, and to get in line to get their vaccine?
Yeah, so let me quickly say that I think Dr. Alexander Scott and Chan probably can do more on explaining this. I think that's coming in Rhode Island. From everything I have seen, is that I think we're really moving quickly towards a more simplified approach, but I'll let them talk about it. I will say this, which is, when you don't have a simple approach, when it is very complex, what happens is that you tend to worsen inequities, because people who don't have family who are super tech savvy, who don't have resources, they're going to struggle to get through, right? And I think of the example of New Jersey, where my elderly parents are. For 4 weeks, they were getting up early in the morning, staying up late at night, going to at midnight to try to sign up. It wasn't working. It was only when my brother and I and the whole family jumped in and started that we eventually got them a spot. They're both elderly. They're both in their late 70s, early 80s. So the point is, we should not have a system where you have to have the whole family doing this. I think your point is exactly right. It unfortunately, I think, worsens inequities. And so I think moving towards a more simple system and a more accessible and an easier system to use is exactly right. And my sense and again, I'll let Drs. Alexander, Scott, and Chance speak for themselves, but my sense is that Rhode Island really has been moving towards trying to make this easier and more user-friendly for folks. But I'll let them describe what they're doing.
And before we move on, before we get to Dr. Scott, it's rightfully so that she should be speaking at this point. This is not new to any of us. N1H1, we've done. Just so if everybody who's watching, we've been through this before. This is nothing new in how we vaccinate people. So I just want to put that out there, that this is not new to us. And Dr. Scott, you understand this also, that we know what to do. We just failed to do it. And I'm not afraid to say that, because there are a lot of smart people in this state who've called me this past month. Let's say even the Rhode Island Medical Corps, Volunteer Corps, who called me. We've done this. We know what to do. And don't get me wrong, Dr. Scott. I know the supply chain and all that. I'm talking about getting the vaccine to people. We have the blueprint. And with that said, so that I don't take up all this time, Dr. Scott, you're the expert. I'm not. I've just listened to a lot of people, and I take it for what it's worth. Thank you.
Thank you. So you can hear me okay? I
Yes.
want to say thank you to Dr. Jha, who I know probably has to go. So certainly have a good day, and we'll continue to stay in touch. Do. So as Neil pulls up the slides for us, I'll be able to start with just expressing appreciation to have this opportunity. A key component to doing public health well is being able to communicate what's been going on. And the challenge we had was being able to do that effectively, having the understanding clear, and then getting it out into the community. So this is an opportunity that we really appreciate having, because it's an additional way to help start to address, the information that we have wanted to and needed to get out to Rhode Islanders better. We fully understand the frustration. There has been frustration felt on this side. We also understand where we are responsible for addressing it. So My hope is that walking you through these slides will give you some of that background to what has been in place and what the approach is and where we are going, and then be able to open it up for questions that I welcome, because it will give an opportunity for us to talk through this and help create the path forward that we have. So, starting off, we are again highlighting our guiding principles. And this is a key component because it allows us to really see the full picture. One of the things that has been made most prominent recently, appropriately so, is a focus on the speed, which is the expeditiousness of our approach. That is an important element. But this slide also helps capture the fact that that is one of several important elements. And a part of why we are in this situation, not all, but a part of why, is for the start of this response, we focused more on some of the other elements and plan to now shift some of that and focus more so on the speed. So some of the other elements that we have focused on at the starting point, certainly we know that safety is paramount. That's going to continue throughout. Really minimizing morbidity, which specifically is saying minimize deaths and minimize hospitalizations, save lives, and keep people out of the hospital. That's a key component both for the patients themselves, but also for our healthcare system. You know, we have had some of the physicians who have been on the front lines in our emergency departments really come to the forefront and share the full extent of what they have been experiencing, how close to overwhelmed the healthcare capacity at least was feeling based on their experience. Um, Being able to really address that head on was a tremendous driver for us in keeping people alive and keeping people out of the hospital, particularly in advance of knowing that the strain was coming. We felt it critical to make sure that we focused on those individuals who are at highest risk of going to the hospital and further overwhelming our healthcare capacity system. And we needed to do that effectively prior to the strain really getting here and becoming predominant. And what that meant, as we'll see, we didn't mean for it to happen to the extent that it has, but what it meant is that we had to really be targeted, strategic, and that takes time. The other key component is certainly the efficient distribution and access. And addressing the access piece also allows for the targeted and strategic. And I appreciate the question just raised, because it's always the balance. How do we make sure that access is there while also continuing to keep it simple and go fast? And so equity is underlying all of our approach. And there are parts there that have struggled, as has been raised more recently, but we stay determined to continue to bring that to the forefront, all of which is a balance. So that's why it's important to have these opportunities to really talk through and help folks understand, and then to also hear from individuals. So the next slide jumps into what we have experienced thus far with phase one. Our focus for the first phase was to really prioritize the most vulnerable. We knew that if a strain came and became most predominant, what would happen is those who were most vulnerable to being hospitalized or dying would be at the forefront of it happening. And we needed to take whatever time we needed and be as targeted as we needed to make sure the limited supply we have really focused on those individuals that would be most vulnerable. So with appreciating feedback from our COVID-19 vaccine subcommittee, excellent partners there, and many other partners, we have really focused on individuals who live in congregate care, knowing our nursing homes have been the most significantly hit by this pandemic. We've all experienced it, and Rhode Island as a state has a larger proportion of individuals in nursing homes. Certainly also assisted living facilities. Our adult behavioral health group homes community has been important. And then also several HUD sites with 202 designation, which basically have seniors in those types of housing complex. We've also focused on adults with intellectual and developmental disabilities and staff who live and work in group homes, as well as in shared living environments and those living independently. Again, populations that are most vulnerable. And then also have worked to protect other vulnerable Rhode Islanders and ensure the stability of our healthcare system. So that's why we focus on healthcare workers, behavioral healthcare workers, dental staff, first responders, harm reduction staff, community and caregivers enrolled in programs run by EOHHS, and then also our congregate setting of the adult correctional institutions because of the outbreaks that were being handled there, and that can be very challenged, and making sure that staff and incarcerated individuals at highest risk were covered there. So those were our general focus areas and a few additional ones, but really highlighting the most vulnerable who would be at risk for hospitalization and death in phase one. The next slide looks at what our progress has been getting through all of the groups in phase one, and basically the status on the right side shows that everyone is in progress. It allows us to highlight that for each phase and for each group, the plan has been not to wait until you finish everyone in a particular group before you move to the next group, but get the group started, make sure that they are accessed, those at highest risk within the groups are able to get vaccinated, and then once that's in place, be able to move on to the next one. And so now we are preparing for phase two. And our guiding principles for that continue to build out minimizing morbidity and hospitalizations, keeping people alive, keeping people out of the hospital, particularly in our more vulnerable populations, but do it in a way that as we're opening up to the public allows us to move significantly quicker. We did not want to continue that more targeted, resource-intensive approach as we go into phase two. We specifically chose the approach of those highest age and going forward by age, along with underlying health conditions and the hardest hit geographies, as a way to both streamline communicating out who the next eligibility group is and identifying them, and being able to move quickly with large volumes of people being able to be vaccinated at one time, which was much harder to do during our first phase because of the detailed groups that were involved. We've also maintained the focus on equity with our phase two guiding principles, looking at and moving forward in our zip codes that have the highest rates of hospitalizations and deaths, so that they can get vaccinated and also minimize how much of the healthcare system capacity is overwhelmed, and then have all of those combined to help us be best positioned to reopen the economy in a way that allows us to keep it stable in that way for the long term. And so our phase two age-based population segmentation data here helps understand why the age approach is a a win-win in a sense that it allows us to get at those who are highest risk, starting from the oldest age and going forward, but then also allows us to move much quicker because it's simple date of birth and just moving to the next category. So this basically highlights how much higher the hospitalization rates and unfortunate fatalities are and associated death rates in the oldest 75 plus, and the hospitalization rates and fatalities and death rates continue to go down based on age from there. And that's not accounting for race or ethnicity, that's just looking overall, which shows it to be, or proves it to be from a data informed standpoint, an effective approach at getting at the highest risk and going from there. The next slide shows similarly when you add to age underlying illness, which can also be referred to as comorbidities, those risk factors become associated also with hospitalization rates. So when we looked at hospitalization data from adults in Rhode Island who had been diagnosed with the coronavirus that caused COVID, we saw significantly higher rates of hospital admissions compared to population prevalence in these specific diseases. Those with kidney disease were 11 times higher in terms of the difference between percent hospitalized and the percent they make of the population's prevalence. For cardiac disease, it's 7 times higher. Lung disease and diabetes are 3 times higher, and the immunocompromised for various reasons or conditions also double when you look at percent hospitalized with COVID versus proportion of their prevalence in the actual population. So this again was the data we used to inform why age, underlying illness, and the next slide goes into geography as a marker. When you look at individuals who live in our more densely populated communities, high density communities, and those are 7 zip codes across Central Falls, Pawtucket, some specific zip codes in Providence, North Providence, and Cranston, you see that throughout this entire pandemic response, cumulatively, consistently, unfortunately, there have been drastic gaps in hospitalization rates for those who live in the 7 specific zip codes in those municipalities compared to the others. And when you adjust for age, you often see also that it's even at younger ages. So that's why it's important to have age, underlying illness, but then also geographic distribution to help really pull out those individuals who are at highest risk of being hospitalized. But now, for phase 2, do it in a way that allows us to significantly accelerate our speed and ability to get to the individuals from the public that need to be vaccinated. This slide reflects the timeline that we have shared. We are continuing to go along the timeline that has been anticipated, in the sense that we have our more targeted groups that I just shared for phase 1. We had, when we first started, needed to really get through those groups and move forward. Now in February, we have, thanks to our municipalities really leading the way, gotten started with those age 75 years of age and older. We are opening up this week the larger state-run sites so that those 75 and older can continue, particularly over these next few days, to really take advantage of the large numbers of vaccination sites that we have. And then as planned, by this time in February, and this is a little bit later on in the month, we're starting, as early as we can. We're always going to try to move it up sooner. 65 plus, as we've announced for Monday to start. And that will be able to really push out because of the ability to use our mass vaccination sites that have been opened. There's the capability of vaccinating hundreds of individuals an hour with those larger sites. So having completed the more targeted groups, we want to still maintain the hospitalization approach, but do it at a much faster pace. So it's important to be able to see that we are on par with our initial timeline. As we get additional vaccine, we'll hope to continue to push this up as much as possible and be responsive to what we agree and have heard of. It's time to move faster. So that's what we're focused on. This next slide just highlights some of the underlying medical conditions based on the data that I showed. This is what we are using to apply to that category as a starting point later on in March, based on the timeline when we open it up to those with underlying medical conditions. Our goal will be to add more conditions to this list as we go forward. We're continuing to look at data, particularly with our behavioral health community. We appreciate the point that those with mental illness or with substance use disorder are also critical to involved in this group. When we say medical, we're meaning physical and behavioral health, and continuing to work on the data to show the hospitalization rates and have that inform how we expand additional conditions to the list is important. One of the keys is to continue to consistently share on the 3 vaccination channels that we have. We appreciate that, in this early phase, it can seem like a lot of information and challenging for individuals, particularly seniors, but just anyone to know which, how do we do this? How do we navigate? It's similar to with testing. We started off slow and gained momentum. We now have multiple options, multiple different approaches to get tested, and it's successful. Thousands, tens of thousands of people get tested every day. But it took time to build to that, for people to get comfortable, to understand what channel works best for them. And so that's why engagements like this are important, so we can make sure you have the information with all the questions you're getting to be able to help explain and help people get educated on what will work best for them. We thought that pharmacies would be an important channel to really push on. It allows for the federal partners to be able to send directly to pharmacies. And when you think about access and how many pharmacies are locally available to individuals, it really allows us to get out into the community and make it so that people have an approachable route to getting vaccinated. And for the most part, people are familiar with, I need to go to my CVS or my Walgreens to go get my flu shot or another type of vaccine. And so knowing how to go online to CVS.com or call your local CVS pharmacy or use your app to access is an important way. And we hope to, over time, be able to expand to other retail pharmacies, Stop and Shop and others, whoever we are able to establish a partnership with, so that there's even more accessibility out into the community. We recognize that that means different ways for people to learn about how to get the vaccine, but wanted to make sure that no matter what, the availability was there through that retail pharmacy approach. The other two approaches are more on the government run side, and while right now it is very dispersed, we do have the full intention of bringing those two together to have one centralized approach with both our local regional vaccination sites as well as our state-run vaccination sites. So over the coming weeks, we will get there. It's important to share one of the reasons why it is so dispersed or diverse right now, particularly for the local regional vaccination sites, was just recognizing how valuable our municipalities, our cities and towns have been and are at really engaging with our seniors, our 75 plus. These are individuals that may or may not, know how to go online and access what's needed, or know how to even get to where they need to go. But they do know, where their local senior center is. They do know where their local city and town is, or their local, elected official, or people in that community. And our cities and towns have done an excellent job registering for them, really just hand holding and making sure that those 75 and older, are senior most, are vulnerable, have access to the vaccine. If we open it up all at once, there's definite potential that those 75 and older would have just, been overwhelmed with just go to a stateside and online and that type of thing. So we did start broadly with the various cities and towns because they are such valuable partners in helping to ensure, and they are proud of it. They are doing a great job at making sure the 75 and older are getting the vaccine. Once that process is complete over the next several weeks, we do plan to streamline more so that we can really build out. We already have the 2 state-run vaccination sites. Those are focused fully on volume, getting as many through as possible. That's where we can get hundreds of individuals vaccinated an hour. And then over time, get the multiple local sites to consolidate to not more than 5 or so regional sites, still run by our local communities, but really be consolidated and maybe even get direct shipments from the feds, so that we have, 8 or so government-run sites with one approach in the future. So for right now, our local regional vaccination sites are really going to continue to do the great work they've been doing with our 75-year-olds and get through as many of them as they can. 75-year-olds also are able to go to the pharmacies, and as of this week are able to access our larger state-run vaccination sites. And as we announced today with our state-run vaccination sites opening up, we're preparing to take all the 75-year-olds we can over the next few days, and then on Monday, really open it up for the 65 and older. And we really want to encourage, as you go out, the 65 and older, push to getting into our state-run sites and our pharmacies. So we want to really let the local municipalities focus on the 75 where they're doing a great job. So going to vaccinateri.org or being able to call the phone number 844-930-1779 is important. Scheduling started today and appointments are beginning tomorrow. And it's really just the start. It's the full acknowledgement. It's time to speed up. We have to push on volume thanks to our National Guard partnership and colleagues and so many others. We are ready and will continue to expand and push as many people as we have vaccine for to get through. And I'll also be able to talk about how now that we're shifting from the more targeted approach where you had to redistribute to multiple partners, you think of, 20, 39 cities and towns, different agencies. It takes time to get it out to them. As we move towards, our state-run sites, we can consolidate, get direct shipment to them, really cut back on how much redistribution we have to do, and push vaccine out and really focus on what's needed there.
Doc, I don't mean to cut you off. Could you hang on for just one bit on that?
Sure.
Can you, doctor? Can
Mm-hmm.
you hang on right there? And I don't mean to disrupt you, but I need to. Can you not see the logistics in that? How disrupting that is? We have 3 or 4 different agencies doing one thing instead of one central location handling it. You got, and it goes right back to Representative McGraw's question. Why do we have 3? And I don't mean to cut you off, but I can't let it go because this is where we're at, Doc.
Yeah,
You know?
for sure. It is a balance. We would love to just have just one site overall, but then needed to figure out how we can make it as accessible in different places as possible. And when you think about our testing approach, we still have the one testing site, but you can still go to your provider. You can still go to a local community-based organization that's doing testing. So there's still different approaches with testing that has been successful. So while it's going to take time to, for people to kind of feel it out, we wanted to, if we were to do just one approach, we wouldn't have been able to engage with the pharmacies because the way it was set
One
up.
approach with the mandate, this is how it's going to be.
Yeah, but the way it's set up with the feds, with this pharmacy, as far as we have right now, it had to be that separate way. We weren't able to pull it into that one system, and we didn't want to forego that.
Not to get you off, not to be rude or anything to that effect. We run our state. We dictate what we're going to do in our state. Am I not correct? And how we're going to roll it out.
Absolutely, but
That's
we're working
that's
with
what
federal
that's what was
partners.
given to us.
Yep.
You know,
Absolutely.
that task was given to us for the states to come up with a plan.
Absolutely. But when we're working with federal partners who are sending us the vaccine, we also have to align with how the program is set up. And as of now, it is set up in this way that the pharmacies have a separate system while we have that one, government-run one. We
have vaccines sitting on the shelf, correct? Waiting for them, pharmacies to come online so that they have enough vaccine to distribute. When we should have said, okay, we're going to give it out. They're not ready to go online. Distribute the vaccine. And then we'll move once they come online or said to the government, we need more vaccine. How come that wasn't followed? Or how come we didn't come up with that type of plan?
Yeah, you were referring to the previous federal pharmacy partnership program that was associated with getting pharmacies to long-term care facilities. I tell you right now, if we knew the outcomes that we were going to face in engaging in that federal pharmacy partnership program, we may have thought twice about it. But when we first understood it, knowing how significant our long-term care community was, we thought it important to opt in fully to the federal pharmacy partnership program that required us, in order to opt in, it required us to set aside the vaccines that partnership was going to do in order to even go forward with them. But we knew it was also a way that they were going to provide on really getting vaccines out to them. It just became challenging for us because we have such a large proportion of our population that is in long-term care, and it required half of the vaccines that we were getting, the 14,000, half of that had to go to that federal pharmacy partnership. Certainly now, as we are understanding how different the administration rates were and the challenges that were occurring, we have stopped giving them more. It's been over the last 2 weeks that we have no longer given them any more so that they can catch up. And we're working with them regularly to pull back any vaccine that isn't used or that isn't administered because someone doesn't receive it. But we can certainly acknowledge, number one, that we constantly ask the feds for additional vaccine, and number two, had to deal with all elements of opting in. Some of the other states just did not opt in up front. And we thought it was an important, valuable program given how significant our population was with long-term care, and have dealt with the consequences of that. So that's how we're moving forward. This pharmacy partnership is slightly different in that we have some more control. We don't have to set aside vaccine in order for them to use it, but it does require that they have their own mechanism for registering. So I can certainly keep
Doc, it's just so confusing, not only for you, but for the people that we represent. And this is one of the issues that I needed to bring up prior to us moving to slide 12, since we've been through numerous slides and presentations prior to this. So we'll move to slide 13.
Definitely. So our vaccine interest notification list is simply available. You can go to portal.ri.gov for people who are not yet eligible for vaccination, so that you can add your contact information and get updates as eligibility opens up to new groups, so you never miss learning of that information. Enrolling in this list doesn't guarantee an appointment. It's still, you need to make the appointment on either the government-run site or the pharmacy, but it's a way to help get notified as eligibility opens up for groups. And then separately, cities and towns also have their own notification lists in some situations. So this is not intended to be a requirement. It's really just a support for anyone who wants to make themselves known.
Okay.
All right. So I'm going to spend some time just talking about what we did achieve from this, and then go through the challenges that we fully acknowledge, and then work through how we're going to go forward. So an important piece to this phase one is the decision we had to make in being more targeted and strategic so that we could decrease hospitalizations. It meant that we were going slower, but it's important to be able to have this type of data to see the outcomes, because it would be one thing if we took that approach and went slower and then nothing, necessarily changed, or our hospital system was still just as overwhelmed today as it was a month and a half ago, or our healthcare workers were still having just as many cases as they were a month and a half ago. What's important to know is that we have seen, by and large, the outcomes we started out to get with phase one. We did not anticipate that, the more time that it took to be targeted would come through in, other reports or measures, because they only focused on the speed and did not focus on what we have made clear since the beginning, which is decreasing hospitalizations. So we are, facing that. But it's important to know that we did achieve, by and large, what we wanted to achieve. Vaccination administration has contributed to a faster reduction in hospitalization in Rhode Island. We know it's not the only thing. It's always testing, treatment, and vaccinations. But to know that it is part of the fact that we have a drop in hospitalizations that is double our neighboring states that have gotten, grade A in other areas. So we had to choose in the outcomes that we wanted. And for knowing in advance of the strain coming, that we needed to make sure that people who are most at risk of getting hospitalized were protected first, that's what we had to choose in doing that, versus the speed piece during the first phase. It wasn't going to be forever. We're now really shifting into the speed component now that we have achieved what we wanted to as a starting point. So as of the 17th, we've administered 165,000 total doses, And as you see, our hospitalization rate decline is more than West Virginia, more than the US average, and more than Massachusetts and Connecticut. This to me is a critical piece. It's definitely hard, definitely frustrating because we want it to go faster. But for Rhode Islanders to know this is what we achieved. If there was a report card looking at hospitalizations, we would be at the top. And I think that that is a very important public health outcome to, make clear while we keep focusing on the other pieces. Here's some additional data that also connects to the testing, the treatment, and the vaccination piece, and really just helps to highlight when you take a step back from the frustration and the mention of confusion and the challenging, and is trying to help make sure that we're getting the data out. Rhode Island is in a much better place right now than we were a month and a half or 2 months ago. That's a critical piece overall, especially in advance of the strain coming. You want to be in the best place possible before that happens so that we have the biggest bandwidth to keep ourselves protected, to keep the healthcare system from getting overwhelmed. We have had a decrease in our test positivity rate. It's been reduced by 65% since December. We've had a decrease in our daily cases of COVID. It's been decreased by 61% since December. These percent decreases are unheard of given where we were at the peak of this just a couple of months ago. We've had a 53% decrease in hospitalization admissions since December, and a 53% decrease in deaths as well since December. So that's a complete picture of public health outcomes that I know is not easy because of everything that's going on. But Chairman, it's an important message to make sure that we have as context. That's not the end all be all, but it's important context. This also shows when you look at the specific groups that we have really focused on for phase one, our healthcare workers, our long-term care facility residents, those in our hardest hit communities, and compare that to the general population. Decreases have happened overall in the general population, as I said in the previous slide, but decreases have happened even more significantly in those communities that we have focused on for phase one of the vaccination. That's critical. And it's because of the testing, the treatment, and the vaccination that we've focused on even more in these areas. But it's critical for folks to understand that overall, Rhode Island is in the place. The trends are going in the direction we have wanted it to go. If it were the total opposite in the midst of the frustration with the vaccination, that would be a different story. But it's important to have that context as we talk about what to continue to do to improve. This next slide again just highlights.
Doc, could you just bear with me? And bear with me because it's a lot to take in now. when people are screaming at you, how come I can't get the vaccine? And I understand what you're doing, and that's what you do for a living, and that's why we point to you, Doc. But the main issue right now is how come we can't get the vaccine? We know what the outcome is and where we're at in Rhode Island, and it's thankful to you, people like yourself. But how do I explain to the people regular that lives next door to me, that lives down the street, why can't I get the vaccine and what is the problem? And I understand it may be simple as supply and demand, but it's a little bit more than that. And before we move on to these slides, because we've been talked to for so long, I've watched you in numerous meetings with you and the governor. But at this point, we're just rehashing information that we already know. But we need an answer. We need to hear other answers, Doc.
Absolutely. That's up next. That's our ongoing challenges.
And ongoing challenges because Because
Reset the
at this
process.
point, can we just hold off for a little bit? You need to hear from these reps.
Absolutely.
You need to hear
Let me
from
go
these reps, and you need to hear what they're hearing from their communities. And
Let me
and
go
at this
through the,
point, can we just hold? Can we just hold? Doesn't mean we can't go back to a doctor, or if not, we'll move forward. I'll leave it
yeah,
in your court.
yeah, no, let's go through the challenges because we definitely, that's why we're here. We have to focus on that piece. It's just important to set that broader context, as you understand. The data that I just shared cannot be taken for granted. That didn't
No,
just happen. That's connected to what we have been doing with the vaccines. But it doesn't explain everything. That's why I said we also need to make improvements. So let's go into the ongoing
and
challenges
I'm just
and then
bringing up
go
the
from there.
frustration that I'm hearing.
Oh yeah,
That's all.
I know.
And I
We
just
hear it
don't.
too.
Yeah, yeah.
Believe
But,
me.
but we're hearing it, but you're speaking to us and nobody's saying anything back to you because there's no really open discussion.
Right, right, right. No,
Yeah.
I know the voices are there. We are very much aware of it. So, and let's go into the challenges because it's real. I
No,
don't
I
want to,
understand.
over, deny that or disregard it because it's real and it's
Yes.
important to address head on.
Okay.
So, we've talked about the fact that our more targeted approach led to going slower, and the fact that for phase 2, we're shifting. It's still going to be hospitalization, but it has to be faster. It has to be simpler. And using this age based underlying illness geography approach also allows us to achieve that. One of our challenges has been explaining the data, like what is going on and why are we having this situation. A high level picture I will explain is when we started with our more targeted approach, we had set the goal to be reasonable, that it would take about 14 days to get from the very beginning of a vaccination, the process, to the very end. So let me explain that. The very beginning of the vaccination process was we would find out from the feds that the vaccine was allocated. Then we have to order it. Then they have to ship it. Then we have to receive it. Then we have to distribute it. And because we were targeted, we had many partners to distribute it to. Sometimes have to redistribute it because some went directly to partners, others went to us, and then we had to get it to partners. Then they had to schedule individuals, then administer. So it made sense because of how complex that was, so that we could be targeted. That an average, anticipation was that it would take about 14 days from beginning when we found out about the allocation and had to order it to the end when someone got a vaccination shot in their arm. So if you looked by the end of the 14 days, we were close to 100% administration. But it was just, that amount of time, and certain times we would not be. We then would have a larger number of vaccines kind of circulating in the inventory, so to speak, to get distributed or redistributed or pulled back for over that course of time. So a key to our goal, and why I can be confident that we will get there because we have to, it's time, is to shorten that 14 days to at most 7 days and even less. And to do that, we have to simplify the number of providers and partners that we work with. We can't continue to work on distributing. We had 20 to 30 plus municipalities we're getting it out to, and all of the hospitals and providers in different places, all of those individuals. We need to streamline that so we have our set high volume statewide sites, 2, 3, 4, however many we need there, most of which we're going to look to get set up so that the feds ship directly to them. No redistribution needed. They get directly what they need. We've already done that with one. We're getting the other one set up to do that, and any other ones that come on will do that. And then the municipal pods, we want to simplify and streamline to not more than 5 regional pods as a starting point. And if we can get that set up, get the feds to ship it directly to them. We want to get out of and going from the targeted phase to this quicker phase. We want to get out of the redistribution, setup, because that's where that inventory of the vaccines would be, because you had to get it to the different areas. As we redistribute, go from that 14 days to at most 7 days, that number of those vaccines that needed to get out into the various partners' hands will go down significantly as our goal. Our goal is to get that down to almost nothing by the end of this month, so that we're not redistributing and have that inventory of vaccines and get them directly into the high volume distribution sites that we keep making as simple as possible. So I think on that previous slide, it just at that high level explained that in that redistribution inventory, we had a decent number of doses, 79,000 doses. It wasn't that they were sitting anywhere or being held back. It was just that over that, time frame of the week once it's arrived, you have to get it out into the different areas and partners, or pull back from partners who didn't get to administer, so that we redistribute it to someone else. So that would take time. If you looked at the end of a 14-day period, the vaccine that came in is gone, but we no longer want to have that time frame. And so we have a plan where we can get out those in that distribution panel. And so we're ramping up capacity at our large, high volume vaccination sites. We are ensuring with the fewer providers that we have that they are doing everything they can to get those vaccines administered right away. We're getting on that. We're getting the information from our retail pharmacies. We're getting the information from any other providers, and we're limiting that number. So it's streamlined. Everyone's gonna know that, we partner with no more than 7 days to getting these out. We're not gonna have to redistribute it anymore. You get it, no wasting of it, and get it out. And have the Fed ship directly to them. And most importantly, we have it set so that we can streamline the data and make it simple and reporting it. That has been one of our biggest struggles, because there are so many different partners and it's redistributing, and every day there was a different, some municipalities needed more and some didn't. It was just extremely challenging for us to be able to say, this is how many we have today. This is how many, we're going to have tomorrow. As we streamline, we simplify, we're not redistributing. It's in that shorter amount of time. There's no vaccine that's in the system just getting shipped from one place to the next place. We'll be able to report it out simpler. And that's a real focus for us. We know that has been unacceptable. And so that's a key for us to continue to make clear and distinguish data based on first and second doses. So that's one of the steps in addressing some of the challenges. And then the next slide, I think, goes in a little bit more in knowing we're going to constantly ask for more. We want to constantly, as we have enough, make sure that individuals who can get vaccinated do. That's an ongoing challenge, particularly in our communities of color and our communities that need the vaccine the most. We want to make sure congregate settings and other places that they receive the vaccine and go ahead and get it. And then keeping equity at the forefront. With all of this focus, we had a really successful rollout in Central Falls and have wanted to do it in Providence and Pawtucket, and are really positioning now to build that back up and move forward with that, especially as we'll have a more streamlined and simpler, faster approach with vaccines, so that we'll know this is what's needed for the communities hardest hit, but all the others go through a simpler approach overall. So there's a lot to focus on. There's a lot to still improve. And I'm eager to jump in with this so that we can add more clarification and partner with you on helping us make sure we get the message out more effectively.
Thank you, Dr. Scott. I just want to say, what a mess. What a mess.
It's a lot.
Yeah, it's a lot. It's no disrespect to you, doctor, or your office. It has a direct result on the people who you work for and how you do logistically put things together to make sure they function so that it's not just dumped in your lap. You're a doctor. We go to you for the answers. Distribution and putting it out into communities. That's beyond you, doc. But it's not beyond you because it's left on your lap, and we all look to you, doc, because you're in the forefront right now. And we're not to be insulting, but I will tell you this is a mess in how it's getting out into the community. But you're doing a great job in explaining to us why it went this way. We don't have to agree with it. We just want to let you know that this is a mess. And I'm not going to suck up all the time. It's not for me. And I will go to Representative, let's see, Place, who was first, and then Chippendale and McAtee. So I just wanted to say that, and not to be disrespectful, please. Thank you. Representative Place.
Thank you, Mr. Chairman. Dr. Scott, I know the priority has been focusing on the more hardest communities, the higher denser communities. WPRI had a report out that talked about how the east side of Providence has a higher vaccination rate than Central Falls. And I was just wondering if you could explain that to us somehow, how, that outcome.
Yeah, it shows that we have work to do, even with an intentional focus on addressing our communities hardest hit. Similar to what's happening across the country, you still have privileged communities that are able to take advantage of access and going online who are getting to it first. And so that also happens when you push to speed and simplifying. So it's why we had felt strongly about having a targeted approach and really engaging with Central Falls and doing the door-to-door vaccinating. But your point and what we have with the data shows it's not enough. So we want to shift to going faster and being more streamlined and making it simpler, but not at the expense of continuing to ensure that our communities hardest hit have the access that they need.
All right, Chairman, I've got 3 more questions, 2 of which are combined into one.
Hang on, I will come back to you. I just want to make sure everybody gets something in. And Representative Chippendale, could you please hang on, Representative, please? Representative Chippendale.
Thank you, Chairman. I'm mostly going to make a statement. I do have a question, but I am going to mostly make a statement here. I don't know how well this is going to translate. This is a handwritten note from a constituent of mine in the largest geographic district in the state. This is how they communicate to me. In the largest district, we have one bus that goes through in the morning and one that comes through at the night in the very northeast corner of our town. This elderly person, closed this note out with, another example that Rhode Island is the state where hope goes to die. This is the frustration that the people I represent and all of my colleagues represent are feeling. And doctors, my comments and my ire is not directed at you as professionals. I certainly revere what you do, and I understand you have a very difficult job. However, Dr. Jha said it very, very well, I think, when he pointed out that the states that are doing so well are the ones that are doing it the most simply. And we aren't. We are overcomplicating it. How does this person go on a link and sign up, whether it's a state link or a CVS link or a town link? They don't have links. They write handwritten notes. This is the population that's dying, and we're not communicating to them. Doctor, you did say that communication is the key and we need to communicate well. But in the last meeting, we heard glowing praise about how well the communications team was doing. And our constituents hear that as well. And that just furthers their frustration when they hear the government, us, politicians and policymakers and elected administration officials patting themselves on the back while they have to write notes to try to find out where they get their vaccines. This is where we are. The slideshows and PowerPoints are fantastic. And when we have 113 paid communication and PR staff, we can come up with lots of great slideshows, but they don't address the issues. We really missed the boat. There are 30 states that have counties that could hold dozens of Rhode Islands in them, and almost all of them are doing better than we are. We are the tiniest state. We bill ourselves as this capital of, and we should rightfully, medical technology. We have Brown, we have Salve, we have so much going for us. We bill ourselves as this technological center. We are a postage stamp, and we can't get it right. If you look at certain national reports, they'll tell us how horrible we're doing. And then if we look at the slideshow, we'll see figures about how great we're doing. Well, the expression, and this is not, again, directed at anyone personally, the expression that liars figure and figures lie is not an expression for no reason. Because if you look at page 7 on the slideshow, anyone from the age of birth till 50 has not died. Every one of them is 0% deaths. And we know that's not true, but that's a figure. So figures can be very difficult for people to interpret, especially when they change every single day. Here's the solution. Get the people who know logistics. All right? When we were struggling with testing, who got us out of that mess? The Rhode Island National Guard. And I understand that they're playing a role in the vaccination, and that's perfectly appropriate, but they should be playing a greater role. We should have guardsmen in every city and town in this state. There should be one central command center who is, of course, responding to either the adjutant general or the governor, but it should be a singular file of hierarchy. There should not be branches everywhere with tentacles of towns and pharmacies. It's not working. Rhode Island is failing, and we just can't continue to do this. I don't understand why we haven't enlisted the National Guard on a greater or a higher level to do more of the logistics, because that is their wheelhouse. They know how to allocate assets, get them where they need to be, when they need to be there, and execute. They've already demonstrated that, and I am pleading with the administration to put their pride and egos aside and admit that they failed, and we need to embrace a different model, completely different model. And that model, in my opinion, includes a very large component of the Rhode Island National Guard. The one question I do have, and this is in reaction to a conversation that I heard on the radio yesterday, where medical professionals who received a link to sign up for vaccines were able to share that link with non-medical professionals. And on the radio, there were people admitting openly, they were hairdressers, and they were able to share this email and get vaccinated. I don't want to argue, and I don't want to be corrected about whether or not that's happening. We heard it on the radio. I want to know, if someone is doing this, are there repercussions? Because if we're sending an email out to a medical licensed professional, in this case, we heard on the radio, it was a nurse that gave the link to a hairdresser. Why are their licenses not on the line when they do something so egregious as to share a link that was meant only for a specific group to someone who is so far down on the list that they're probably going to be vaccinated next year? Are there any repercussions for these people, doctors, or anybody, if anyone can answer?
Yes, thank you for your comments. I want to address your comments and then jump in quickly on the question. In terms of the paper you showed, and as a reflection of our seniors, that's exactly why we have engaged our municipalities, our cities and towns, because they are filling out the registration for them. They're making it so that they don't have to go online, but they have local access to be able to getting them vaccines. So that's an important piece.
Doctor, I'm gonna interrupt. I'm sorry on that, because I need to clarify my district. My district is very small. We have mostly volunteers who do a lot of the critical elements in our towns. But our DHS directors in our towns are elected officials. And in one of my towns, anyway, the former DHS official retired, and a new one has been elected who's trying to learn the job of of being the DHS director, and now this person is also having to deal with a vaccine rollout. So I don't think just simply saying we're counting on the municipalities is a good thing, because there are municipalities that cannot handle it for various reasons. We need someone who knows how to handle this, and that's the National Guard. I again apologize for interrupting, and we'll shut up now.
Yeah, no, there are some who are challenged, but I just really wanted to uplift and make clear that municipalities that can are doing what they can to address the fact that our seniors need the support that they need. The report card piece is an important one. We do not like at all the grading that has occurred for Rhode Island. But it was important to share the context, because if any of those grades were based on how much have you decreased your hospitalizations as a result of this, we would be doing significantly better. That being said, we're not going to stay there, because we want to get better in terms of the speed. We knew what was happening in our initial approach. It's time to focus on speeding it up, and we are equipped to do that. I'm sure General Callahan is thrilled to hear your points about the National Guard. That is, my compadre and colleague for sure. I can assure you how intricately involved the National Guard is in this entire process. The fact that we can see hundreds of individuals an hour at our large vaccination sites is in large part because of the National Guard. So they are directly involved, and it's appreciated what you said about getting them involved more. And then the last is the piece about the link. We have intervened whenever we've had someone inappropriately share the link. We've made it so that they have not been able to get the vaccine, whoever has accessed it, and have held them accountable to that. And overall, we're moving away from that. As we're going to this faster, streamlined version, we can get out of avoid the link sharing business. We can get out of the redistribution business and really move towards pushing out vaccinations as quickly as possible.
Okay, thank you. Representative McAtee, please.
Thank you, Mr. Chairman, and thank you, all the doctors. One of the things, I've been getting, obviously, the negative emails and, oh, we're in last place, and when am I going to get the vaccine, and how do I sign up? Pleasantly today, I was able to direct people right to the state site, and they actually were able to sign up, and many of them are going tomorrow to get their vaccine. So I'm thrilled about that. But these same people, and my question is, they've signed up with the town, they've signed up with both pharmacies, and now they're getting vaccinated tomorrow. So, it just seems it's not very efficient that way, because they're signed up everywhere. And I don't know how that's going to work out. And the other question that I had from the 65 and over is, if they sign up Monday, are they actually going to be able to get a vaccination like the next day, like we are right now with the 75 plus? Or is this going to be, you're on a list and you wait? We don't know the answer to that. So
yeah, I'll start with your second question. The goal for opening up to 65 on Monday is to be able to start vaccinating Tuesday and beyond. We've opened up appointments for the first week and a half.
Oh,
so
wow.
they'll be able to choose for a date for that time frame. The part that you mentioned about the cancellations is an important one. It's one that we're needing to balance with having as many options as possible to go as quickly as possible, with the fact that, as people choose, we want to encourage them, if you've made a different appointment, cancel on the other one so that vaccine can be given to someone else. On the flip side, we've made it so that regardless of if someone shows up or if they canceled in advance, there's a system in place to get the vaccine to the next individual so no vaccine goes wasted. And hopefully with time, similar to on the testing side, right now with testing, you could go 2 or 3 different places and get, different tests set up. And we're still able to make it work where we're doing thousands of tests a day. I recognize that with vaccine isn't at risk of being wasted, but we have been very effective as part of our targeted approach at minimizing waste of vaccine. You spoke to that last time. Our rate continues to be 0.2% of vaccine wasted, and usual goals are like not more than 5% or 10%. So we're doing very good with that. We'll need to continue to work on keeping it in the single digits.
Well, they were thrilled to get an appointment. I helped about 5 of them myself. I'm filling it out on the computer. So, and I gave different people the phone number. But, you know, I'm thrilled that you finally got the state site up, and hopefully we can move these out. I think if everyone can just get the vaccine, everybody will calm down. And another couple of things, the teachers, obviously, that's still an issue. If they're not vaccinated and they keep getting exposed, then they have to go home and quarantine for 2 weeks or whatever the 10 days, whatever it is. And the other one is the restaurant workers. They are constantly exposed. So I know I like the fact that you're going from the older people down, but if we're ever going to open up this economy, we really got to start with some of these other folks who need, like the teachers, like the restaurant workers, and on and on. But anyway, that's my 2 cents, and thank you for opening up the site. I think it's going to make a difference. It made a difference with several of my angry 75-plus-year-olds today. So, thank you.
Okay,
Yeah, with it.
thank you. Can you hang on to that, Representative Alzate, please?
Thank you, Chairman. So thank you, Doctor, for going through the slides. I actually found them, it answered a lot of my questions that I've been having. I think that I have more so of a statement. Something that I've spoken to other colleagues, especially my colleague next door in Central Falls, Joshua Gioraldo, is we were really concerned that the way that the vaccine rollout was going to be kind of a mess, because we saw that was happening in, Pawtucket and Central Falls. We were the last of the state to get testing sites. It was a mess for us, and it was left up to the cities and, all of these things. And so one of the things that we have spoken out about a lot is the fact that we really hope that you are listening to us when we ask you to please make sure that the rollouts are organized and they're managed well. And it is a lot, and it's a lot for, just a few people to take control of. And so I'm happy to hear that you understand that what has been put in place is not necessarily working for everybody. And, it sounds like everybody has their hand in the pot, and that's really what seems to be hurting us. And so having distributions, getting them from the feds, coming here, and then redistributing it to other sites doesn't sound like that is a very well thought out, organized plan. And so I'm glad that you understand that, because I think that that's where we need to really get organized and have real management when we start to, Pawtucket is having vaccine clinics this week. Central Falls is continuing to have them. Other parts of the state are going to have them. And, there's a lot of frustration out there. And to me, what I hear is that you are all doing a really great job as much as you can. We just need to be a little bit more organized and have a little bit more management when it comes out to the vaccines. But I'm glad that you understand where I'm coming from, and that, that your department is taking a look at that. So I just wanted to say thank you for that.
Absolutely. Yeah, that targeted approach meant that we were doing a lot of the redistribute, like in order to make sure that exactly the healthcare workers that needed it, we had to redistribute, to exactly the municipality that needed it. We had to, do some of that caused it to be in that system. And that was necessary for the phase 1. We have to shift for phase 2. That's been the plan. This is how we're going to do it, and make it so that we don't have a lot of that redistribution as a part of the process. It's direct and able to get out more effectively, while not foregoing those communities, those zip codes that have been hardest hit, there we'll have to still keep it targeted, but it will be a smaller proportion. The higher volume, the majority will go through, those simpler, larger sites.
Thank you. Rep. Fogerty, Rep. Gioraldo, and Rep. McGraw, and then Rep. Place. So just hang on, I see you.
Thank you, Chairman. And I wanted to give kudos to the Department of Health on the trends. I mean, that is important that we have seen a reduction in the hospitalizations, even better than what's been seen, and West Virginia has been touted as giving the first, doing the best with their distribution of vaccinations. I mean, bottom line is that we are reducing hospitalizations and thus death. With that said, kudos to you. The ire that we have felt as representatives in the past, ever since the vaccine has been out, is hard to even quantify and qualify here. We've all had it, and I know you're moving forward, and I understand more people are going to be vaccinated, and it's going to be much faster. But I want to make sure that more of the 75-year-olds are captured before we start reaching out to the 65 plus, because I know that there are friends of my parents, and my parents are my constituents, and believe me, I've heard it from them. And I mean, it's been a nightmare for my parents to even get vaccinated. My mother hasn't been vaccinated yet. I got my father through the VA. He went for an eye doctor appointment. I said, can you ask them if they can vaccinate you? And that's how he got his. My mother hasn't been vaccinated yet, but we do have an appointment finally after 5 of us stayed up after midnight one night. In-laws, her son-in-laws and daughters and her son, 5 of us trying to get online at CVS after we were shut out in a Connecticut mishap that happened for a lot of Rhode Islanders. So lots of frustration from a lot of my constituents who got shifted over to Waterford, Connecticut for a vaccination. So, and we're hearing it all. So, and I know some of my parents' friends who still haven't gotten a vaccine yet and are confused. I mean, I'm trying to reach out to friends of theirs in other districts and try to direct them on how to get vaccinated. But I worry when you're saying you open it up to 65, well, we didn't capture all the 75 plus year olds. And that's one of my biggest concerns, because I know it was left to the municipalities, but hearing from municipalities, they feel like they got dumped on. And my thing is taking steps back. We knew this vaccine was coming. Why wasn't there a targeted and organized plan for the municipalities to get their lists together versus people calling their senior centers and trying to get their names on a list? My parents haven't even heard back from our town about getting a vaccine yet, and that was weeks ago. So the planning was poor from the state that should have known if they were going to reach out to the municipalities to have those lists ready. And I worry about down the line if there's going to be boosters required for these vaccines. You know how that's going to unfold, because we hear about mutations. That's what people are getting very upset about. There's mutations coming. Are they going to be covered in time? It's life or death for all of us, but certainly for the people who are 75 and older. So I just really want to make sure that they're all targeted, and I don't know how we're doing that. It doesn't seem like we've captured everybody, and that's most concerning, because that group does have a higher death rate. So I'd like that addressed. And I'd like to go back to Dr. Jha saying some of the most effective states are simplicity of rules, singular focus, no vaccines left on shelf, and full power of the government. Someone running it out of the state, out of the governor's office. We have a switch going on with governor now. Do you feel we need to have somebody out of the governor's office that is running this to make sure that this continues to, as we go faster, to make sure it's rolling out better and more efficiently? I guess there's a lot of questions in there, and I have to agree with the teachers being vaccinated too, only because we have one of our own, Representative Messier Vassell, who's had to quarantine twice because of exposure, and she teaches in the Providence school systems. So maybe the higher, areas of Providence, Central Falls, get those teachers vaccinated so they don't have to keep taking time out of work, and it's just time out of the children's school schedule. It's a lot I'm throwing at you, Doctor, but I feel it needs to be addressed.
Absolutely. I'll go through some of them. I'll start with the last one with the teachers piece. We know 60% of teachers and faculty staff, up to 60%, are going to be captured in this approach, but that also does include our more densely populated communities, as you just said. Like if we looked at Providence and Pawtucket, I know Central Falls also focused on teachers who live there, so we are building that into how we want to do this, and we'll continue to expand, particularly as we get additional vaccine. In terms of the governor's office, our whole concept, particularly when you hear how Dr. Jha explained it, it refers to what we have in terms of a whole of government approach. We have recognized this is a public health response. Public health is core, but this happen alone without, or, alone by, just public health without the partners engaged. And so that's why General Callahan has, been holding me up and, right with us in the National Guard. And we have had a full whole of government response. And certainly with Tony Silva and the team, the governor's team that Lieutenant Governor McKee is looking to build, there's an intention of continuing that whole of government response. So I wouldn't change anything. It's really about knowing that there needs to be unified support, bolstering the public health leadership and response. In terms of the concern that you expressed about 75 to 65, I would say we had that with you and did our best to kind of hold on. We're now like the 40th plus state to go to 65. It was part of the balance. It's like you focus on the targeted and get at the 75, or you get these grades that say that you're going too slow. Those that are going faster didn't get to really, cater to them to the same extent that we have taken the time to do. They've done it in their own way, but it's been the balance. And so we haven't wanted to depend just on municipalities, but certainly have appreciated what the municipalities have done in really catering to 75 and older, and making also the pharmacies available to them and otherwise, but also recognize in the need to go sooner, we have to expand to 65 and keep expanding from there while not foregoing making sure our 75-year-olds continue to get prioritized the way they need to. So we'll continue to determine ways to do that. And to build on the municipalities piece that I know felt, it felt like what you described, and it being they felt dumped on and that type of thing. It was one of those scenarios. Municipalities, we had been working with them and planning on municipalities initiating their vaccination of 75-year-olds to start February 14th. So they were ready for that. It would have been organized. It was ready to go. Because we have been vigilant about making sure there's no vaccine that goes unused, a week and a half earlier than February 14th, we were able to pull together 5,000 vaccines. And we said, we want to start getting 75 and older as soon as we can. Do we wait for the municipalities to be ready on the 14th? Or do we try to give it to them and see if they can help get started? And doing that made it so that they were like, we planned for the 14th. This is like, the 3rd or whatever date we had that conversation with them. And it wasn't a good feeling. We learned on our end. They learned. We've been able to repair that, but just wanted to speak to what was behind that. And for the boosters piece, I don't know if Dr. Chan, you want to say anything about that? I know there's been a lot of questions. And I would say certainly all these lessons learned, we'd make sure we apply those and how we roll it out again in the future more effectively.
Yeah, thank you, Director. I think just regarding the booster issue, we've had a lot of ongoing conversations about, can we delay that second dose? Do people need a booster? How long does the vaccine last? And, we're following the evidence and the science. And really, at this time, the CDC, the FDA, the entire clinical community, at least here in Rhode Island, is really recommending to stick to the schedule. So having a booster shot at 3 or 4 weeks, depending on the Moderna Pfizer vaccine. So we're following that for now. However, I think as the director's alluding to, we're carefully keeping track of all the evidence, all the recommendations, and obviously if there's a recommendation or the science supports spreading out a booster shot, delaying it, or if we can even get away with half doses or whatever we can do to stretch the vaccine, we'll definitely be willing to consider it.
Yeah, I wasn't really talking about changing the dosing. I agree, the first and second should be given. I was talking about boosters down the road. There's been some talk about possibly, I'm not suggesting it, I'm just saying possibly the need for boosters. So hopefully we learn for that. I'm talking after the 2 doses.
Yeah, I understood too.
Hang on, that's, well, let's get the first one out.
Well, absolutely.
Ready. Well,
Just wanted, I wanted to roll smoothly.
Let's get the first one out.
Absolutely, I agree, Chairman.
Representative Gioraldo.
Thank you, Mr. Chairman. To start, I also want to give credit to credit where credit is due. Like Rep. Fogerty did. Kudos to everyone that put in the work to get a reduction in the hospitalization admissions, along with the massive drops in positivity rates and cases. Those are really, important numbers and deserve recognition, and those are having an impact on my city that had high hospitalization rates. So I appreciate that, and I also want to thank you again for highlighting the social and emotional, the social and environmental factors that created the inequities that COVID brought closer to light, that you talked about in your last presentation. But something that's critical to highlight is that Central Falls is a city that's fresh out of bankruptcy, and pre-COVID was actually really on the rebound. It's been relying on the kindness of city staff and volunteers to staff the vaccination site and keep it running successfully. Every time I go and stop by and check it out, I see every member of the mayor's team working long hours, after hours, and on the weekends, around the clock. And with that being said, Central Falls, and I bet other municipalities, have not received a penny to support the operation of the site. So it's volunteers doing registration, it's volunteer nurses, it's volunteer everything. And I'm really worried about the sustainability for that. And so my two questions are, I know we talked about a certain amount of money going to every municipality to support their municipal pods. That hasn't happened yet. And so I know Central Falls hasn't received anything. And so two questions. One, why hasn't there been any financial support to municipalities to just help with the cost of running a vaccination site that's vaccinating thousands of people and is basing it off of the kindness of volunteers? And then second, to Rep. Chippendale's point, why isn't the National Guard being utilized for these vaccination sites? They were utilized for our testing sites. They could be used for registration. They could be used for assisting with transportation of our vulnerable residents. And so I just don't see it. And I understand that they're probably going to be designated to the state site, but our municipalities are still struggling and need that support. And so if you can speak on the financial support and why isn't the National Guard being utilized to help our cities?
Doc, if I may, before you answer, fiscally, if you're not able to speak to that, the money aspect of it, we'll get somebody here to speak to that, so that we're not putting you on the spot. What I mean, Doc. And the other question you can answer.
I appreciate that. I'll just speak to the National Guard piece, and then we'll allow Alicia Mahalakas, one of our fearless leaders with this, to share what's possible from the municipality support standpoint. For the National Guard, for sure, I mentioned just how intricately involved they have been, both at the state sites, for sure, in keeping things running, and then, as you mentioned, in the testing and treatment sites. And it's really just about continuing to have the partnership. It's not completely one way or another way only. There is a willingness to continue to engage with partners, so that National Guard, which is, a certain number of amazing individuals, but a certain number, it's not able to automatically just go to every single city and town. So we want to, particularly with the focus on moving quicker and being more streamlined, be thoughtful about how we deploy our great colleagues in the National Guard, and certainly have opportunity with continuing to think through that. Alicia, do you want to add some more in terms of things?
Sure. So thank you for the question, and we think it's a fair one. We too believe that the municipality should be receiving money to be able to support this. So we put out purchase orders to every municipality in the state for some of the planning activities before we ever got to the actual execution of the pods for the first component of things. So there was money for adjusting plans for social or physical distancing, we call it, inside the existing pod plans. There's funding for the receipt of additional supplies to support the pods overall. And then there was funding for the first activation of the regional pods because every municipality participated in that process. So there are some invoicing and deliverables that need to go along with those, but every municipality is eligible to receive that funding, and they've done a variable job submitting their paperwork in order to receive those dollars. There's additional funding that's coming that will be available to every municipality for the support of their work that they're doing right now for vaccinating the folks who are 75 and older, as well as additional funds that will go to the host sites for the that executed the regional pods.
Excuse me, Alicia, is that the CARES money?
Yes.
Okay, good. So for
the first pot of money that.
yes,
I'm sorry. Go ahead, sir.
I'm just worried because someone from my city who's probably watching. I sat in a meeting with the mayor yesterday, and he said, or his team said, they applied for some of the CARES money for just exactly what Representative Gioraldo was talking about, and they received nothing. But I will direct them towards you so that we move on from here.
Mr. Chairman, if I can just follow up on that, when would we expect that municipalities can actually see money for staffing? If they fast-tracked all of the reporting necessary, how quickly can a municipality get money to sustain their operations? Because our site is literally being run by volunteers, and I'm worried that running a few clinics every single week is draining, and I'm worried about sustainability and retention. And so I just want to be clear about and have an understanding as to when can they actually expect that financial support for the bodies that are doing the running the facility.
Sure. Again, a great question. So the funding that's available right now is sort of an after the fact, right? They will be reimbursed for funds that they expended, or if they've hired staff or paid staff to perform some of those duties. As we shift our model, again, from a simplicity perspective to the regional local model, we will have CARES Act funding, to your point, Chairperson, that we will have that CARES funding available through FEMA and other partners, because 100% of vaccination activities are now eligible for reimbursement. So we will be able to provide support to those regional pods on an ongoing basis to support what the needs are there. We don't expect that it's fair to sustain, that every municipality has the ability to sustain this kind of activity, which is why, again, we're trying to streamline it into a regional model. But if you want it for the funding for right now, every municipality has completed the work that needs to be done in order to get the additional funds that were offered to them. And I will tell you, those came through the CDC. Those funds come from the CDC. We have access to that money. It's not money that we're waiting for. So as soon as the invoices are submitted, we can turn that around to the Department of Administration for payment.
Thank you. Representative McGraw, and then Place. I'll get to you shortly.
Thank you, Chairman, and thank you for sticking with us and answering our questions. The questions are numerous. I know my fellow representatives are getting a lot of questions from our constituents, so I thank you for taking the time. I do want to circle back. The first question that I asked before the presentation began was regarding Dr. Jha's comments about simplicity. And I specifically asked about making the process simpler for patients to enroll in the process. I don't really feel like I got an answer to that as to whether or not we're going to have a simplified system, one database where people can all log on to the same process that might get dispersed out to those various distribution sites, but I don't really feel like I got an answer to that. Dr. Jha also said he talked about simplicity, and he talked about making sure that we used all the doses. And I'm concerned that having all of these multiple distribution sites is going to slow down the process. We talked about distribution as being one of the points that really slowed down the access to vaccines across the state. And by having multiple distribution points in this manner, I'm concerned that that's going to continue. That being said, talking about distribution, included in the WPRI report about vaccine distribution, I noticed that particularly in the East Bay, vaccine distribution has been incredibly poor. When we look at the map that they laid out as far as the per capita distribution of first doses, the East Bay, specifically Newport, Portsmouth, Tiverton, and Little Compton, were all lower than 56 per thousand. And so what I want to know is there a plan to do an East Bay regional pod to make sure that people in the East Bay are not forgotten? I think about even with testing, I've had conversations with people from Little Compton. The closest state testing site for them was in Newport. That is a 50-mile round trip for them to get a test at a local testing site. So what I'm asking is, will there be a better opportunity for people in the East Bay to have a regional pod where they can get access to a state mass vaccination program?
Thank you. So I'll start with the last question and then go to the first question with that. With huge thanks to Alicia Mahalakas and Trisha Washburn and Britton Bates, we are working very closely with municipalities and collecting information back from them so that we can partner in setting up the 5 regional pods and help ensure that across all of our vaccination centers, where our state-run ones are and where the regional ones are, that we are geographically placing them in the areas that we need to. And there's a definite focus on the East Bay having what they need. So we'll be making sure, certainly with you, highlighting that we bring that back, as I'm sure the municipalities and the team is focused on being able to do. The initial piece that you said about making things simpler allows me to, kind of share that larger picture of what we are moving towards with the future state. It's simpler and faster is our goal. So we have multiple municipalities as the local regional approach right now because of how great a job they are doing with really catering to our 75-year-olds and those who are writing on paper and have different ways that they need to get vaccinated. We know that that's complex and there's a lot going on. In order to effectively get to the faster and simpler and faster, we have to streamline that to just the 5 regional pods. And our goal is going to be, out of the 3 channels, pharmacy, local regional, or statewide, 2 of the 3 will have that one way to log on so that everyone can use one component to get onto their site, and that's the vaccinateri.org website that we shared with the phone number that we have provided. So going forward, in that future state, once our municipalities finish with the 75, we're going to take as many weeks as they need to, so we get through as many of the 75-year-olds as we can. But we're starting now, and we'll move towards having streamlined, simplified vaccinateri.org as the way to go, or a local pharmacy that you're familiar with. And so that's going to be that simplified way, and we'll be able to monitor, appointments and registration. Does that answer what you're getting at?
I'm glad to hear that at least 2 of those mechanisms are going to be through one website that's going to make it a little bit simpler. Ideally, I would like to see that any way to get a vaccine would go through one, and I think that would eliminate some of the things that we have discussed earlier. For example, patients making appointments at multiple sites. So if everything could go through, including the pharmacy access through one access point, then we would eliminate the potential for people to have appointments at multiple sites and have people not showing up, and the potential for wasted doses. And I just think that if there is a way that we can incorporate all of the mechanisms into one system, that would be the ideal solution.
For sure. We agree 100%. We would absolutely want all the pharmacies to be combined into it. The way we've been informed that it is set up through the feds is that they are maintaining their distinct amount. So anything else we have control over, we're putting into one and making it so that it is just those two.
And I did see that in Massachusetts, there was actually a resident of Massachusetts that found a way to incorporate that all into one site. And the state of Massachusetts is working with that person. It was somebody who happens to be home, with, a computer person that's home over, stuck with COVID, working from home. And I appreciate when people are home and trying to help with the solutions, and I hope that Rhode Island will look at a similar program so that we can get us to that point here.
Yep, we will certainly continue to explore, but it is challenging to force what has been set up on the federal rollout piece. Plus, with the system we had when we built it early on, there wasn't the understanding that we were going to need to have to force them together. So we don't have that capacity right now. If we did, we absolutely would. And we'll certainly continue exploring and seeing if over time there's a way to get there.
And I know you said that there's going to be a portal where those under the age of 65 can log in just to register to get their name in. Will that be also part of that same process, or is that going to be an additional process?
Yeah, right now it's a distinct website. It's the same website that's used for testing. So at least it's not a third new website. It's portal.ri.gov. So folks we want to continue to encourage people to use that as well to get tested regularly. They can go there to put their information in about wanting to be notified on eligibility opening up for vaccines. And then for when you actually go to schedule an appointment, it's going to vaccinateri.org.
But again, if we could simplify that so that people could register through there, not necessarily make an appointment, but at least they're registered through that site when their time came up, it would just make it that much simpler.
Yeah.
Simplification is just, really what I'm looking for.
Mm-hmm.
Very good question. Representative Place.
Thank you, Mr. Chairman. I literally just had someone call and ask me this question, so I've got a couple others on the line too. When we're looking at these mass vaccine sites, I'm not seeing facilities that are readily accessible to seniors. And I'm just wondering what actions or what activities have you taken to make sure that these facilities are accessible to the seniors, just something as simple as parking and wheelchair access.
Yep. Britton or Alicia, you okay with that? A lot of thought has gone into it.
Sure. So, for instance, at the Dunkin' Donuts Center, we recognized that there are many accessibility challenges at the Dunkin' Donuts Center, including handicap parking as well as accessibility. So a couple of strategies were implemented there. One is that the majority of the activities will happen on the concourse so that there's no need to traverse up and down inside the building. So things will be maintained on one level. There are additional ramps and other accessibility features that have been enhanced at that site to ensure that there is better accessibility than what currently exists. Britton, I don't know if you want to comment on any of the other work that they've done there.
Sure, I can say that at the Dunkin' Donuts Center, we added a lot more. We worked with the city to make sure that we were going to be allowed extra handicap parking right outside the front door. We deliberately put 2 different addresses, Representative, on the description of the location so that people would know if you needed ADA accommodations and had mobility challenges, you could park in front, use this GPS address. If you did not, then please use this other address and you would be at the garage. The Dunkin' Donuts Center staff staffed up on our recommendation with a whole bunch of ambassadors. So they made all these ambassador positions to help the people get them in the building. There is signage throughout everything in multiple languages and with pictures to also help with other accommodations, people who perhaps don't speak or read English. So it's multiple languages and pictures. We brought in far more wheelchairs that already existed there, but we brought in more wheelchairs and again, ambassadors to help move people about. I'm trying to think what else. We got other assistance for in the observation area to assist these folks with making sure that we get their second doses scheduled. Like in the same essence that we know some of them need assistance from family or friends or others on a special call line that we set up because they may not have computer access. We did the same thing. So we have extra people in the observation area to ensure that the seniors walk away with their second dose schedule already. And then as far as the Sacanasset site, it is both sites are sort of a one-way in, one-way out flow for efficiency. And it has a ramp both at the front and the exit at the Sacanasset site, and it's all on one floor. We really, even though we have old buildings in New England, and there's not a lot that we can do with our buildings, we do the best we can and try to always make sure that we don't use stairs anywhere and make sure that a flow works for everybody who has mobility challenges. And we also staffed up at the Sacanasset site with more people to assist those folks who have mobility challenges and brought in more wheelchairs there also.
Well, that's great to hear. Couple follow-on questions in terms of progress that we've made since the vaccine rollout. What percentage of the first responders and what percentage of the nursing homes have we seen actually vaccinated?
It's a great question. Let me get back to you on that actual data point so that we get it to you clearly. We know we've been working with the Federal Pharmacy Partnership, particularly on the nursing homes and the long-term care. They've needed to complete all 3 of their rounds so that they could get us the full percent administration or percent vaccination coverage data, and we can have a clear sense of what other gaps we need to fill. So through Neil Heitenen, we'll make sure that we get that back to you, sir.
All right, and looking at Massachusetts, it seems that they're starting to move towards an idea of making sure that not only the targeted vaccinated people, the targeted vaccinated population are getting the vaccine, but their caregivers are as well. I know I've got a lot of questions from constituents dealing with specifically parents of children with leukemia and things like that are particularly particularly in danger of getting exposed to COVID. Do you see the Department of Health moving away from their current denial of parents getting the vaccines?
Yeah, what we have right now, particularly with the supply, is the focus on who is at highest risk, and it's not as clear right now, although it could be at some point, that the risk of transmission to that extent would be prevented effectively by vaccinating the caregiver. That being said, it is an approach that makes sense. And so as we go forward and make adjustments, it's definitely something we are anticipating exploring.
And Doctor, as a member of the General Assembly, going forward, I'd appreciate that if someone on a committee is asking questions, as you're saying you're going to get back to us, that you get back to us and it doesn't show up in the press. You know, I had a very difficult time asking questions 2 weeks ago about the number of vaccines that are being lost, and you just seem not to want to answer the question. I think it was very disrespectful of this committee to get that answer in a Providence Journal article. So I would hope going forward that any member of this committee or any member of the General Assembly is inquiring of from your department what's going on, that we get the answers prior to you releasing it to the press. Thank you.
That sounds good. Neil Heitenen is our legislative liaison, and we'll certainly make sure we continue to keep that communication going in advance. Are you on mute? Are you saying something, Chairman?
Okay, I'm sorry. I want to thank everyone for showing an interest to our communities. But we will have another meeting, and we will have public input on the next meeting. I think it's very important that we hear from the public. We can do our best to bring it to you. I thought we did a bang-up job tonight.
Yep.
I'm not satisfied, and probably most of us aren't. But I do say thank you for bringing the information that you do have to us. So with that said, be ready for us in about 2 weeks, I guess, 2 or 3 weeks. We'll be back. With that said, I want to say thank you. Thank you very much. This concludes tonight's hearing. Thank you.
We look forward to it. Thank you. We know that you all have been experiencing a lot with questions and all of that as well. So we were eager to, one, get it clear ourselves, and two, be able to equip you with what you needed. So thank you for continuing to be ambassadors going forward. And I really want to honor the ones who, you know, you see me, but you get to hear and see the voices of my true heroes in Alicia Mahalikas and Trisha Washburn and Britton Bates Manny, who are tireless and amazing in the work that they do. They give their hearts. So thank you to them, and thank you to all of you.
With that, I say thank you. And we'll conclude this meeting. Oh, Representative McAtee, you have a question? No. Good night.
Take care.